Welcome to the Love and Victory Show with Val, the place to laugh, sip on a little wine, and have open and honest conversation. Here you will find the tools to resolve real-life issues. Unwind, pour up a glass, and get ready to exhale. All righty, welcome to the Love and Victory Show with Val. This is Dr. Bourque.
Hello,
I am
everyone.
so excited to have you here, and we're going to go where no one has gone before.
Okay.
The conversation is uncomfortable is comfortable. Mm-hmm. Are you ready for that conversation?
I am, for sure.
Before we get into that conversation, can you tell the people who you are and how did you get to the Love and Victory Show with Val?
Sure. Thank you for having me here. I actually am a pelvic floor physical therapist. So I treat people for different issues or challenges within their pelvis, whether it's their bladder issues, their reproductive organ issues, or even their bowels, or with pooping or constipation, pregnancy, postpartum. And so what that entails is just it's physical therapy, but it's just for within the pelvis and the system that connects to the pelvis.
So please help me understand. Would that be for male and female?
Yes.
Oh, excellent. So this is going to really help us in this conversation that we're getting ready to. We're going to get uncomfortable to get comfortable.
Uncomfortable is my space.
Okay. And truly, when you guys, I want you all to really listen to this conversation because we're going to have some takeaways that's going to change our lives. And notice I said change our lives. Dr. Bourque, your practice, what made you go into this? Were you a nurse before, or were you a therapist? Why did you go into this line of work?
Well, I've always been a therapist in my career path. I mean, obviously, when you're younger, you start going back and forth between things. I always knew medicine or medical field would be something I would do. I just more so honed in on physical therapy as a whole after my last year in undergraduate. Okay. So I did my graduate work in physical therapy. I've been a therapist for over 11 years and historically have seen more neurological issues, which are people with strokes or difficulty walking or something like that. And in the last few years, on or around the pandemic, have kind of shifted gears towards pelvic health. It's always been a space I've been interested in, but because of how intimate it is, how private it is, and just life, I haven't had the opportunity or time to focus specifically on that until here recently.
But do you think it could have been because people just have been so afraid to talk about things that are uncomfortable as it relates to their sexual activities and sexuality? Or do you think that?
I mean, for sure, there's an element to sexual health that has drawn me towards this space. I've always been a big advocate for women's health. I graduated from a women's university, and so women's health has always been very important to me. And it's good because it helps both men and women,
right?
Whether they're in a relationship or just in their own self-understanding of their body.
And what's really important is that a lot of times women don't really understand what's going on. If a woman doesn't understand, she can't explain, and the man definitely doesn't understand. And then when he's struggling with his issues, they usually don't talk about it
ever
because that really plays into their. Until they really are in a desperate spot.
Yes.
Because that plays into their ego. Am I right about that?
I think so, and I think that a lot of times men don't necessarily see it as a thing that can be fixed. I don't know how many times I hear people say, I didn't know there was something I can do for this pain I have during sex. I didn't know there was a thing I could do other than wear pads for bladder leaks. I just thought constipation was a thing, or women who are pregnant and don't know what to expect, especially first-time moms. Even second-time moms, they don't know what to expect during the birthing process. So all of those areas are things that I'm able to address within my practice within pelvic physical therapy.
You know, and before I really dive into some of these questions, I kind of want to, some of the questions that I have in the back of my head that either I've had with my girlfriends or just in passing with someone that may have mentioned it. One of the things that kind of sticks out to me is that when I am a menopause, I'm at that, am I? Oh,
maybe,
my.
no.
No, I'm not.
Oh, maybe a around.
What age is that?
Usually that's towards like the latter end of your 50s, but some people can start it early.
Oh, that's
or
me.
Even,
I'm 59.
Okay.
So things change.
They do.
A lot of things.
A lot of things.
What are some of the things for women that changes at the age of menopause when you get there? So let's talk about that.
Yeah. So for one, sex may feel different because, I mean, one thing that changes is estrogen, right?
What is that?
Estrogen is a hormone that historically our body makes, especially during your fertile years, where you're...
So I'm not fertile anymore. Oh, that's what they say?
Well, I mean...
I'm just asking.
Yeah. I mean, so not necessarily... Yeah,
I've taken this conversation completely off track.
It's okay.
But we're going to go there.
I mean, when you think about it, estrogen is one of the things that allows your vaginal tissue to feel plump, and the integrity of it is not irritated easily. It's lubricated, so a lot of women experience vaginal dryness. From a bone standpoint, your bones, if you don't take supplements, can also start to be more what they call porous or have more holes or like spacing within it, which is more brittle and increases the risk of just pain or fracture. There are changes that are just you experience with hot flashes.
Can we talk about hot flashes and mood?
Okay.
You know, everything that you're saying, I hope there's someone that is getting that part. Now, the part that is just sitting all in my lap is the hot flashes and the mood changes. What is that all about?
So, I mean, there's some elements of it that are because of the changes that are occurring with the hormones in your body. And so an increase in blood flow just kind of sporadically that occurs. I haven't done a lot of research on the mechanism that's occurring during a hot flash, so to speak. But it definitely has a lot of impact on the hormonal changes that are occurring. Similar to that of like a teenager would have whenever their body is hormonally changing into
the menstrual cycle,
menstruation, menses. But it's the opposite, where you're having less menses. You may have more sporadic menses, and then it kind of goes away altogether within the in the menopausal.
Okay, so let's talk about the mood. My husband, I know if you're listening out there, baby, I'm really trying to get counseling for this. Let's talk about the mood swings. So what causes that? Because sometimes I can really be this great upbeat person and I can see we can work through it. And then there are other times that it's just like, give it to me, I need to deal with it and keep moving. And sometimes I can be real.
Yeah.
What is that? Is that age or is that?
I don't know that it's age per se.
It's
solely. No, it could be a lot of things. I mean, you got to think we just came through a pandemic, right? So people's energies, people's ability to process things have changed, and that's usually when I rely a lot on my psychotherapist to kind of help people navigate their mood changes, aggression or sadness or happiness. I kind of lean into the psychotherapy aspect of things because they have a lot of tools
that can
really process
so
what is happening.
So maybe I need to go talk to them because sometimes I really get into this place like, come on, we got to get it together. I have 50 million things going on. I don't have time for the slow walking. So I thought it was just menopause.
No, but slow is important though. Because again, a lot of what I do, I treat people for just that fight or flight, like let's go type mentality.
And that's what he keeps telling me. I need to just slow down.
Yeah, because it allows your parasympathetics, which are this part of the nervous system.
Okay.
Your fight or flight, your relaxation. That's your relaxation area, just to kind of rest, digest, let things calm down. So I do a lot of calming down of that system within my treatment.
Well, actually, I'm glad you said that because I need to book an appointment.
Oh, okay.
Because I do need to work on, one of the things that I do believe in life, and on the Love and Victory show with Val, having candid conversation, I think you're also supposed to be transparent. I don't want to ever come off as a person that's sitting down here talking at people. Healing comes from really being authentic and being truthful. And I do need to work on slowing down, relaxing a little bit, because I always have everything firing off. And so, I'm going to put myself out, and I'm actually going to book an appointment with you.
Okay.
And we're going to go into that
later.
Really now we're going to get this thing back on track. Okay. Because I think it was still on track.
Yes, it was all within what we're talking about. Okay. These are uncomfortable things that people...
And what better comfort place to have this conversation for me than in this space?
I agree.
Somebody else probably would say,
somebody else.
You would choose to have a conversation like this for everybody to listen to?
Somebody will probably connect with it, Even with, you had asked earlier, like why would I go into this? I always ask any of my close family or friends, they're always like, you're the one that just shies away from the conversation about sex. I historically was one of those people great, I'm glad you're having a great sex life, let's move on.
Yes.
And I had to dig into it.
Why you were that person.
Yeah, and that's one of the elements, understanding it from a scientific standpoint, help me be able to speak about it better. So
wow.
I'm happy to speak about
I am so happy, guys, that we have this young lady on, Dr. Bourque. She is really she's just a very honest and a relatable person. And I'm just so grateful that you chose the Love and Victory show to come have this conversation and to help women and men move into the healing process and really understanding what's happening with their body. And that's what this is all about. What are some of the myths or common misconceptions about sex, significantly with females?
I would say one of the greatest myths is women do not desire sex.
I'm sorry, I know.
No.
I'm sorry, guys. What she just said, I actually literally just had this conversation. I was talking with my husband. And what you just said, I just said, no, women don't desire that. I mean...
Oh, that's a myth.
It's a myth because we do.
Yes.
Okay, so go ahead.
Yes. So, I definitely see people in all walks of life that have different relationships with intimacy and sex. And some of that stems from how they grew up or even just their life experiences, sexual trauma, just culturally, religion. There's a lot of things that impact people's relationship with intimacy, with sex. But there are a lot of women that do desire sex. And they are very confident in their sexual health. And they'll even say, that's a priority in my relationship. So
now, how do you determine what's healthy desire and what's unhealthy desire?
I think every individual should determine what's healthy for themselves.
Because when I place what's healthy for me on you, then now I'm judging you based off of my own insecurities or unhealthiness. Would you say that?
I think what it ends up doing is really just creating this taboo space related to sex, which sex is health. Sexual health does a lot for endorphins in your brain. It's exercise. It increases blood flow. There's a lot of health related things associated with sexual experiences. And if you had something going on with your heart, if you had something going on with your weight, your brain, anything, we would address it. But when it comes to sex, there's this taboo, relationship.
We don't want to talk about it.
No.
And I think that when we start to talk about anything, again, I keep going back. You're not alone. When we start to talk about anything, we're talking about healing and moving forward. Yeah. So for me and for the one that's out there listening, and even for you, you said you had to get to a place that you were not uncomfortable talking about sex. Mm-hmm. So you are a married woman.
Yes.
And a mother.
Yes.
How does your husband feel about you going on a podcast, the Love and Victory Show, having this conversation? What did he think when you said, baby, I'm kind of changing my direction a little bit? What did he think?
He's all about it.
Oh, wonderful.
Yeah, he's all about it. I mean, he doesn't find anything strange about it at all.
Well, that means that there is something healthy.
Yes.
You know, and that healthiness comes from always having that conversation with him.
Well, see, that's the thing. Like, that's a place that was always so uncomfortable for me to discuss. You know, like, there's people that are just so open with their sexual desires and what they want, or even just, you know, I mean, I historically have been a little bit more conservative when it comes to discussions about sex. And I had to learn through science, really helped me learn, you know, that it is health.
It's health.
Yeah.
It literally is health. It is not about, it is what it is, right? Okay. Okay. Well, do you think the lack of comprehension on sex education is impacting everyone in their conversation and their decision making?
Absolutely.
Can you elaborate a little bit?
Yeah, on that? I feel as though by the time women, during the changes that are happening in teenagers' bodies, right, men, young boys, young girls, their discussions around sex are very minimal. They just kind of talk about, this is your body, this is what sex will do, and this is what happens. And it's basically stems around pregnancy. But what ends up happening is there's people, like, I don't know how many times I hear people say, when I was a kid, ... when it comes to bladder issues, right? I mean, you have to, in order to pee, you have to take your clothing off and your genitalia is there too.
It goes with the process.
It's all part of it. And so there's people constipation, not having the ability, and so they don't know about those systems, and so they don't talk about it. And then it kind of trickles into adulthood. I have many patients that have never looked down at fun fact. A lot of people just say, oh, it's a vagina. Well, actually, it's not a vagina.
I'm glad. Break that down, yeah.
So the vagina is just a canal for entry point or exit, right? Down there. But other than that, you've got other things. The whole space is called the vulva.
The vulva.
Okay, so basically, like, the whole space, the triangle of a woman's vagina, right, is, I mean,
that's
vagina space, right?
That's space.
It's actually the vulva. The vagina is just one part of it.
So why is it that people only know the vagina and not really understand that it's more behind that?
Yeah, I mean, I think that's just society. Like, they just go, okay, here's a vagina. Like, people think the clitoris is just this little dot. It's actually a whole organ that goes internally that's very similar to...
You went really fast about that. You said people think that the clitoris is just a dot.
It's like just a little spot like this. Honestly, there's some people that don't even know what the clitoris is.
Y'all see why I have to have her back in? We're going to get educated here. It's probably... we're not just educating women. Yeah. We're educating men
too.
And I think this is a conversation that we have to have. And when we have a licensed professional that can break this down and then feel comfortable having this conversation, guys, you have to tune in.
Yes, absolutely. Going. So, I mean, the vulva is the entire space down there that has different openings. There's different tissue. There's spaces that your tissue, there's integrity that your tissue should be, right? And then when there's changes to that tissue, you know, you should be able to talk to your provider and say, hey, listen, I'm experiencing this, right? And so usually, like you were even talking about menopause earlier, there's changes that happen with the tissue. Lubricants can impact just how tissue feels during intercourse, and people are like, I don't want to have sex anymore. And it could be as simple as changing what type of lubricant you use.
Well, I think that part right there, and then we're going to jump back into these questions, because for some reason we're going to that. And so that means that there's someone that needs to hear this.
Yes, for sure.
Menopause.
Yeah.
Lubricants.
Yes.
No, I appreciate that. What is it you said changing your lubricants?
Yeah.
What is that?
So you think KY,
Oh.
right? And that's KY is like I mean, not to call out a brand or anything.
Yeah, but no,
but it's a very known brand inside. You can get at the drugstore, right? There's some, breakdown of tissue that can impact, not necessarily with KY itself, but just how that's, like a lubricant is made.
Which is chemicals.
Chemicals within that,
yes. And see, that's what people don't understand. You maybe have used something for a very long time, and then your system
changes,
and
now
you
it
need
doesn't
to change
tolerate
that.
it.
Okay.
Yeah.
Okay.
So there are other lubricants, which is something I love to talk about with my patients, that are, just created to be in the same balance as a woman's vaginal opening in their vagina. Oh. So some people get, recurrent yeast infections or different medical issues because of the fact that they're like, every time I do this, every time I have sex with this individual or someone, these things happen. But they don't necessarily look into it even more. And that goes back to what you were saying about, do people understand their body? No, I don't think it's not their fault. It's society. It's how
I think people are just uncomfortable with really discussing what's going on with their body because they're worried about how someone else is going to view them.
Exactly.
Versus, I need to be healthy. I need to take care of me. Yeah. So the other types of lubricants that you're talking about, is that something, and I guess we're going there, and this is going to be a part 3, part 4, part 5, part 6, I don't know. Yes. This is the education show. Is that something that you can purchase over the counter, or is that something that you actually literally have to have a physician write your script or a provider write your script?
Oh, you can purchase those things over the counter. Okay. But it's just, most of them are not. The ones that I would recommend are not in the drugstore.
Oh, so then you go to some of the...
you can go on Amazon for some.
Oh.
You can also go to, the actual makers, and they can tell you where to purchase some of them.
So is that something like what are those pharmacists called? Some of those...
like those local pharmacy...
That, that kind of mix up...
Yes. They may not have them. They're already created.
So you just need to go to Amazon and get it. Okay, well, we're gonna at the bottom of this, we're going to leave them for a few links, a few trinkets that they can go, those that are going through menopause, that they can go and click on and go try it. Now, we're not, by any means...
No.
Reese, talk to your doctor.
Yes.
Talk to whoever. Get with the physician. We want to make sure that you're not allergic, none of that.
Absolutely.
But these are just recommendations that can possibly help you.
Correct.
Yeah. So, okay. We're going to share that. All right.
I 100% agree. You definitely need to talk to your physician
Talk to your physician first.
But, honestly, these are things you can get over the counter
literally.
as well.
And I think that we really need to, and again, I recommend that you reach out to Dr. Bourque, because she really can help you at least get to a comfortable space to have a conversation, that you feel comfortable and safe asking the questions. I'm up here trying to ask them for you. What I can think that a woman like myself, old or young, would want to ask someone. I don't know why I'm on this platform doing it, but I guess God knows and I am here. So I'm the one. I'm going to ask you a couple of more questions so we can get through this. We can't get everything out today, but we're going to come back.
Yes.
And again and again and again, right? So how do you think sex affects straight relationships versus homosexual relationships? Do you believe the LGBT community is often left out of the conversation about functionality of sex in a safe place? That's a lot.
That's a lot, but it's also a very important conversation.
Yes.
I do feel that our LGBTQ brothers and sisters are left out of the conversation in the sense that, the default is heterosexual when it comes to medical information, medical education. There's things that is not discussed just in society. And a lot of even our transgender, brothers and sisters may not have providers to go to that treat in their area for whether it's hormonally things that they need, or if they were born without a uterus but identify as a woman, they have a harder time getting the treatments or the services that they need, given how their body is. Again, just conversations about homosexuality and their intimacy. Like, you don't see it as openly discussed. Just general. It's just considered as taboo as the conversation about sex. It's changing. I do think it's changing.
I actually had one of my nurse managers that worked for me years ago in my other professional career. I won't name the company, but I will say she was amazing. She's working on her PhD for that very same thing, because she's in a space where she's dealing, not her personally, but professionally, wanting to make sure, because when you go into medicine, you go into medicine for the whole person.
Yes.
Correct?
Yes.
And so it you shouldn't align yourself based off of the race or the sex or the creed of a person. And so her focus now is on transgender, because she really is concerned about the lack of care that's out there for him. And just thinking and listening to you right now, I think she would really be an awesome person to connect you with.
Yeah.
Because I do believe that the whole person needs to be treated. I'm not advocating one way or the other. I just think that if we look at people as human beings, instead of passing your biased opinions on people, or trying to, and I don't know how this conversation is going there, but I'm going to go there, or trying to hide behind
norms
and religion.
Yes.
Because a lot of times we make our norms be our sacrificial religion, and religion has nothing to do with Christ, in my opinion. I think Christ just cares about the whole person, or whatever religion that you are.
Yeah.
Okay. So, I don't know why that conversation went there, but I just needed to go there, because I think when we start to talk about individuals and seeing people as an individual, we can start to care more about the person.
Yes.
Okay.
And their health.
And their health, because that's what we're here to talk about, their health. Okay. Do you often see clients who use sex as a coping mechanism? And what does that look like? And how are some of those recovered?
Ooh.
Let's just start. Do you see clients that use sex as a coping mechanism?
I wouldn't say that my patients are using it as a coping mechanism, but I do think that there's some people that don't understand their relationship with sex, as people don't understand relationship with money, which I know that's what I mean?
No, that's really good. I like how you broke that down. That's a good comparison.
Okay.
Okay, I like
Thank
that.
you. So because, people just kind of go through their relationship saying, oh, this is what we do. We do missionary and we have sex, and maybe I have an orgasm. I don't know what an orgasm is. I don't, there's so many elements about their body and their relationship that they don't really, with sex and intimacy, self-pleasure, not self-pleasure, all these things that people don't necessarily navigate or understand. They're just going through the motions as people do with money. Like, some people are like, oh,
that is such a powerful, right there. I'm sorry. I hope that our editors get that. That's such a powerful message. It's just like you said, like money. They don't understand their finances. Just like you got to get to understand your finances so you can be healthy in your dealings with day-to-day life, you need to understand your body.
Yes, exactly.
Wow. That was eye-opening there. What are some, we got to finish that question off. What was the back of that? You said that sometimes people use it could use it as a coping mechanism.
I don't think they do.
They don't.
I don't think they necessarily, I don't experience that element of their sexual health. And if I find somebody that I'm working with that has an unhealthy relationship with sex as it pertains to, there's some sort of level of emotional suppression or connection to it or what have you, that's when I would, reach out to my psychotherapists that are relationship therapists, sex therapists, so that they can help them navigate how to handle the, the psychological aspects.
Because there's something else going on there.
Exactly.
You stay focused on what you do, and that's the pain about the physical part of that, what's going on. Great. I'm going to ask this one question, or do you have time for two? I'm going to ask this. What are the benefits? Oh, no, I'm not going to say. Yeah, I'm going to ask that. What are the benefits of finding a relatable provider, whether it be a male or a female, for someone that is struggling with their sexuality?
That's a good question. What are the benefits of it?
Or
the value in it?
Yes, the value.
Oh, man. If you have a provider that, one, you don't feel like is hearing you, listening to you, it can change how much you communicate, right? And that can actually impact your health. Historically, women of color are traditionally not listened to when they speak to their providers. So even in that element, it's important for them to find providers that they feel comfortable having conversations with.
And I'm glad you brought that piece up, but I'm going to pull that out a little more, because women of color and men of color for centuries, forever, has not been heard when they go to their provider. And then we had this influx of African-American physicians, providers that have come in, and then we go to them, and then we find some very good ones that are relatable. But then we also have that element of those that still don't listen. Why is that?
I say if there's ever a physician that you don't feel is listening to you, you need to leave. You need to find a different provider. Reach out to people that you trust and love and see who they go to. Find somebody that you're comfortable with and then start that navigation. Case in point, when I was giving birth, I didn't want to have an additional C-section. And the provider I was going to was like, that's just what we do in our practice.
Yeah.
And I was like, well, I've already done my research and I know that I don't need it.
It's not necessary, yes.
And so I went to a different provider, and she was fantastic, and she heard me. And
I'm glad you brought that part up. Can you tell me, and I promise you guys, I'm trying to keep this thing on track, but she has a wealth of knowledge that I think really needs to be shared. And
thank you.
It really does, and I think agree. That because I have a great niece, and her first child, they had to do, please forgive me, she had to have a C-section. After her first child, they just said, okay, we got to do another one. Why is that?
There is very small percentage, like 1%, 2%. I can't remember the number, so it's failing me. Research does show that depending on the time frame between baby number 1, baby number 2, your risk of uterine rupture, which your uterus is where the baby lives. After they do a C-section, they cut that open. It weakens it can weaken the uterus during the labor contractions, right? Okay. But there's it's like a 2%, 1% rate of uterine rupture.
Oh, wow.
With recurrent C-sections. Now, I'm not a physician, so you've got to take the full person into consideration, their health, the health of the baby, and any other, medical things that might be going on. And that's why it's important to have a conversation with the doctor that you trust, because if there's someone you're speaking with that is just telling you that and you're kind of skeptical of why,
you need to dig a little further.
Dig a little further. Yes. They should be able to open up to you and tell you why.
I guess why I brought that that statement out there is because for me, I guess I want to understand why, or is that because they're more concerned with protecting its liability, or is it because it's more of a convenience? And I want to believe, I'm not a physician, so hey guys, I'm looking straight into the camera. I don't need anyone getting on my page on this site trying to say that I'm trying to be something or I'm advocating one way or the other. It's information for me too. And as this provider we have here, she's just trying to give us just a baseline, not something that we know to be with every case. Yeah. So I don't understand why we would take a young person, a young, healthy person, and feel like if you had one, you need to have another. So my thought is it's either one for convenience to kind of control my schedule, because I've been in healthcare a while, long enough to understand that it's too important for them to control their schedule. And then the other thing is liability. So would you say that could play into the decision?
I mean, I think that both, and part of it could be the convenience from the physician's standpoint, or the mother-to-be, and there's just there's some people that just opt to just continue with a C-section, because if I've already impacted my body here, I don't want to impact my body down there as well.
But your body's already impacted.
Yeah, I mean, to me, I mean, I didn't find value in having another C-section just because of my first experience. Right. But I mean, I can't speak for all physicians, and I don't think that all physicians are looking from a convenience standpoint.
I 100% agree with you.
Yeah, and I don't also think that
they're looking from a liability.
I just think it's important for people to have conversations and trust their provider.
Yes.
If they say you need a C-section, believe them. And if you can't believe them, that's a problem.
And again, before we wrap this up, because I promised I would not keep her long because she has to go see patients. So it goes back to trust your gut.
Yes.
Trust your gut and make sure that whoever you're sitting down, whatever you're talking about with a professional, whether it be a professional as your tax representative or your attorney. Yes. We're talking about healthcare today. Make sure that you trust them. Yes. And there is someone that you can relate to. Yes. So with that being said, this has been a fantastic conversation. It's going to be an ongoing conversation. And once a month, we're going to talk about the things that are uncomfortable so that we can get comfortable. I have gotten a little more comfortable, and I am going to book me an apartment so that I can relax.
Yes. Come see me. I'll take care of you.
You'll take care of me?
Yes.
Well, again, Dr. Bourque, tell them how they can find you. And we'll let you guys know, as I said, down in the bottom of our post of what are some of the lubricants that you can use and where you can go to find them. Yes.
So you can find me on Instagram. I give a lot of tips, tricks, intermittently on just pelvic health at Dr. Mamawa Bourque, at Dr. Mamawa Bourque. And then on my website, which is Awareness Pelvic Health, you can go there for booking. Awareness Pelvic Health is my pelvic health PT practice, and I treat people for pelvic pain, pain with intercourse, pain with sex, bladder health, all the things. And I just love what I do because I think it's very important for people to understand that side of their body. It could even be life-saving. So.
What part of town are you in? I know you're in the Houston area.
Yeah, I'm in the Heights.
She's in the Heights. Do you know she's central for us? Yeah. She is in the Heights area. Wonderful.
All sides, you can come very easily.
All sides, very easy to get to her. Well, thank you so much again. Thank you for being a part of the conversation here at the Love and Victory Show.
Absolutely. Thank you for having me.
I love you. Bye.